The tibia is the large medial bone of the leg. It articulates with the condyles of the femur and the head of the fibula above and with the talus and distal end of the fibula below. It has an expanded upper end, smaller lower end, and shaft. At the upper end are the lateral and medial condyles, sometimes called lateral and medial tibial plateaus, which articulate with the lateral and medial condyles of the femur and the lateral and medial menisci. Separating the upper articular surfaces of the tibia, condyles are anterior and posterior intercondylar areas. Lying between these areas is the intercondylar eminence. The lateral condyle possesses on its lateral aspect a small circular articular facet for the head of the fibula, here. The medial condyle has on its posterior aspect the insertion of the semimembranous muscle. The shaft of the tibia is triangular in cross-section, presenting 3 borders and 3 surfaces. Its anterior and medial borders, with the medial surface between them, are subcutaneous. The anterior border is prominent and forms the shin. At the junction of the anterior border with the upper end of the tibia is the tuberosity, which receives the attachment of the ligamentum patellae. The anterior border becomes rounded below. There it becomes continuous with the medial malleolus. The lateral or interosseous border gives attachment to the interosseous membrane. The posterior surface of the shaft shows an oblique line, the soleal line, for the attachment of the soleus muscle. The lower end of the tibia is slightly expanded on its inferior aspect, shows a saddle-shaped articular surface for the talus. The lower end is prolonged downward medially to form the medial malleolus. Here it is. The lateral surface of the medial malleolus articulates with the talus. The lower end of the tibia shows a wide, rough depression on its lateral surface for articulation with the fibula. Let's review the main structures on the tibia. Lateral condyle, medial condyle, anterior intercondylar area, posterior intercondylar area, intercondylar eminence, facet for the articulation with the head of the fibula, tibial tuberosity, soleal line, anterior border, medial border, lateral or interosseous border, medial malleolus, articulation for the talus. Fibular notch. The fibula is the slender lateral bone of the leg. It takes no part in the articulation at the knee joint, but below it forms the lateral malleolus of the ankle joint. It takes no part in the transmission of the body weight, but it provides attachment for the muscles. The fibula has an expanded upper end, a shaft, and a lower end. The upper end, or head, is surmounted by styloid process. It has an articular surface for articulation with the lateral condyle of the tibia. The shaft of the fibula is long and slender. Typically, it has 4 borders and 4 surfaces. The medial or interosseous border gives attachment to the interosseous membrane. The lower end of the fibula forms the triangular lateral malleolus, which is subcutaneous. On the medial surface of the lateral malleolus is a triangular articular facet for articulation with the lateral aspect of the talus. Below and behind the articular facet is a depression called the malleolar fossa. Here it is. Head with styloid process, articular surface, shaft of the fibula, the medial or interosseous border, lateral malleolus, articular facet, malleolar fossa.